Hello and welcome to The Franchise Life. I am your host, Stacie Shannon. Today, I am so excited to introduce an emerging brand called Gameday Men's Health. And with me, I have Evan Miller, who is the founder of Gameday. And for the very first time ever, I have a co-host, Dean Kapneck, who is a successful franchise owner. He has owned 15 European wax centers and knows the franchise industry in and out. Welcome, gentlemen.
Thank you. Thank you for having us, Stacie.
Yeah, thank you, Stacie.
Yeah, my pleasure. So, Evan, let's start with you. Absolutely. I mean, you founded this brand. It was established in 2018. You first franchised in 2022, and to date, there are 10 franchise locations that are operational, and you've sold almost 30 territories throughout the United States. So give us the backstory. How did Gameday come about, and what is the brand about?
Yeah, absolutely. So my background actually, Stacie and Dean, is in clinical psychology. I went to grad school. I wanted to be a psychologist. And right after grad school, you have to do a lot of internship hours. I started working in an addiction treatment center and just fell in love with the work, fell in love with helping, especially men recover from drugs and alcohol. It was just something I felt passionate about. You see the light kind of come back in their eyes once they recover. Had the opportunity shortly after grad school to work in a very large addiction treatment corporate company, thousands of locations throughout the country. Acadia Health is who they are now. Operated programs, kept my teeth on the business side. And at the time, a coworker of mine said, "Hey, we should start something up. There's no, detox model in Southern California that we felt really strongly about." So we said, let's do it. We started up just a small 6-bed detox center. We were helping, people, get off drugs and alcohol. And this was 2013. There was just so much demand for the services. We scaled fast. We went to a couple hundred beds throughout California really quick. That industry is 24/7. There's, people don't get sober through 9 to 5. It's like middle of the night calls and all those things. I had just gotten married. I thought, all right, this is probably a good time to maybe think about pivoting and doing something else. So my wife and I just got married. We moved to Hawaii. And for a year in Hawaii, we just kind of hung out. And I thought, what do I want to do next? We were trying to have a baby, and we're just having some difficulties. And so we talked to some doctors on the island. And they said, yeah, you're probably a good candidate, for IVF and look at that route. And so we actually did. We went that route, and we have our first son as a result of that. But during that time, I had lots of blood work done myself, and I was 36. I was like not feeling great. And I thought something might be wrong. Maybe I was depressed. Maybe I was just in a bit of a funk because I like to work. I'm a worker. I don't do well when I have lots of breaks. So I thought maybe that was it. But sure enough, my labs came back and they ran testosterone on me. My levels were in 200s. I'm 36 years old and active guy, eat well, sleep well, do all the things you're supposed to do, work out, and still just levels were really low. So that kind of got me thinking there's something to this model where, men need to have testosterone levels optimized to feel their best. When you have low testosterone, poor energy, poor sleep, poor mood, poor libido, kind of feel like you're walking around in a fog. I thought maybe there's something to this. We moved back to California, and I started kicking around a model originally to do kind of like group therapy in my man cave environment. I'm a guy, most guys, we like sports, and thought, well, how can we create a healthcare environment that guys will show up for, knowing that men are the least likely to show up to a doctor or any kind of healthcare professional. We're the most likely to miss an appointment, most likely to end up in the ER. So I thought, well, maybe we'll do like a group type of mindset training in a man cave. And I just thought, I don't think the market's ready for that. Thought back on my own experience with my own kind of low testosterone levels, that light bulb went off. Looked at the market and realized there was just nothing out there that I personally would want to go into. It was just kind of the branding was kind of strange on a few of these clinics that already existed, didn't speak to me. So I thought, we're going to do testosterone replacement. We're going to put it in a man cave environment, and we're going to remove all the pain points for guys to show up to the doctor. Number one, when you walk into a game day, the idea for game day was born in that discovery. It can't feel like a doctor. When you walk in, it's got to feel like, maybe I'm in a sports lounge. Maybe I'm at just like a man cave, in someone's basement. Certainly cannot feel cold, sterile medical environment. That's number one. And then you got to be fast. So for treating guys on testosterone replacement, you can't have them run around town to go to different labs. Number one, we hate getting blood draws. We hate getting injections. Those are the two things involved here. So I thought, you got to remove those pain points. Let's put a lab in every office. And that's what we did. So we opened our first game day office in 2018 in Carlsbad, California. And the first day, I remember I was like, man, holy cow, what'd you do? You created a model here where guys have to show up, give blood, and get injections. Good, smart one, Evan. I couldn't have been, more wrong. It just took off. It took off like a rocket. We had a line out the door from day one. I thought, all right, we really have something here. The guys loved that we were fast. Mostly when men think of going to any kind of medical environment, they think, all right, half my day's gone, so let's just forget about that. But what we did at Game Day, what we continue to do is we put what is normally 3 or 4 appointments in about a 45-minute span. So we offer free consult, which includes a testosterone test. Step 2 is meeting with a licensed provider. And then step 3 is potentially starting treatment all within an hour. So we have a lab on site that gets your testosterone levels back in 15 minutes. We believe it's every man's right to know his testosterone levels. And it's just been a huge success. It's beyond just a great business model, for those of you listening who are potential, franchise owners and investors. It's a model where you're really changing the lives of men in your community. And that's a really cool thing when you can kind of have those two things combined: profitable business with helping the community. It's a big win. And that's what we're looking to do now, is just have a game day in every city in the U.S.
That is fantastic. I love the backstory. I love having founders on here to learn about how these brands came about. And I will tell you, and I have no shame of saying it, I'm a menopausal woman. So I am, 2 years ago, I had my first experience with hormone replacement therapy, and it has been a game changer. So I know men deal with, when you talk about low energy, low libido, all those things, they can cross with men and women. But what I really love about this brand is, sometimes men can, and don't take this wrong, I have 2 men on this podcast, but sometimes men can be like, a little too proud to go get help or what have you. So having a place that is dedicated to men and meeting those needs and evaluating them is, I think, just phenomenal. The other aspect of this that you mentioned, Evan, is the immediate results and the labs being done in-house within 15 minutes, I believe. My experience to date has been I've waited 2 to 3 weeks to get my labs back after having blood drawn, and that is precious time where I'm still dealing with symptoms. So I think that, I honestly in this space don't know of another brand that offers that immediate result. So with that said, Dean, what questions might you have for Evan, since you're an expert in this space?
I'd like to know, and thank you, Stacie. I would like to know, Evan, is your client base membership driven? Do you sell packages that can bring down the costs of visits? And how is Game Day getting exposure? Are you in storefronts and medical offices? And if so, how is the traffic coming in? And how are you building up your books and staffing? I've got a lot of questions.
Yeah.
That's a lot to break down.
We'll go through it all. Let's do it. To your first question, Yes, it's a membership model similar to a gym. For guys, about you, Dean, for me, just give me one price, let me sit on it, take my credit card and off I go. And so that's what we've done at Gameday, is just made it simple. We don't nickel and dime and have all these separate fees. It's a simple membership charge.
And how much is the membership monthly?
Program. So the baseline testosterone program is about $199 a month. That includes medications, it's all your supplies, includes oversight by the medical team, includes 24/7 access to the team as well via text. Guys want to text on these issues. You don't want to talk about them at work. And then all your labs as well. So it's bundled into that membership fee. It can also be, the meds can be drop shipped to your door. So we try to make it as convenient as possible. So we have two options. Guys can either come into the office and get the injections by one of our medical assistants. And some guys prefer that. Other guys are like, look, ship it to my house, show me how to give myself an injection. And once guys do one injection themselves, they're kind of like, wait a second, that wasn't too bad. Okay, super simple. And off they go. So a lot of guys opt, I'd say 70% opt for at-home kind of drop shipping, where the meds arrive every month and they do their injections that way. We have weight membership programs, that weight loss membership programs as well, that are recurring revenue. Dean, our erectile dysfunction programs, those are more packages. So we do a few different treatments that help men overcome ED beyond just the pills, right? The pills are kind of like, T-ball. What we do at Gameday is, really taking to the major leagues to help treat the root cause of ED issues, not just kind of put a Band-Aid on it, which is what a lot of the pills do. So, guys who come in, they're going to meet with a licensed clinical professional. They're going to go through a full evaluation, make sure that, they're good candidates for our treatments. But those ED packages range from anywhere from $3,000 to, some of them are over $10,000 for those packages.
And how long does that package, if somebody was to come in and purchase the $3,000 package, how long of a time frame does that give them?
Normally 6 weeks. And then the higher package, like a $10,000 package, is about double that.
And then is there any kind of, customer satisfaction guarantee on that? I'm sure you get hit with that kind of a question.
You get hit with that question. So we're a medical environment, right? So you can certainly never guarantee an outcome. What we do say is, look, we have a lot of strong research behind every treatment that we use, tons of patient satisfaction. We can never guarantee it's going to cure anything. We always stay on the compliance side. But the results speak for themselves. Guys who buy these memberships, they tend to come back maybe for kind of maintenance, almost like an oil change, every year or so. So that works well.
And you are, according to the business model that I read the breakdown of it, your current locations are in medical facilities?
Yeah, so we've toyed with both, right? So when I first operated opened our Carlsbad location, it's in a medical kind of building, not a hospital, but more just all medical suites. As a chiropractor, there's med spa, that kind of medical plaza works really well. The reason we like medical is because it tends to be turnkey. So a Gameday office, we're not requiring you to do a bunch of TI. We like just to find an office that has maybe 4 or 5 exam rooms, small lobby or reception area, and maybe there's a sink in one of the offices. That's it, which is nice compared to a lot of other medical models where you got to do tons of TI. Everything needs certain plumbing. We're looking for very basic medical build-outs. So turnkey medical is great. And we've had a lot of success with landlords saying, hey, we'll take it as is. And, maybe they'll chip off a little bit on the rate or give us, a couple months of free rent. We do have retail spaces too, retail. It's interesting. I always thought one of our offices in Temecula is retail, and it's right near like a big hamburger place, and there's a gym across the street, a CVS, and a huge Gameday sign. And I thought, oh, we're going to get guys all day just drive by and come in. We do get them, but it's not a huge value add. So what I found is retail, it's a nice to have. It's not a need to have. Certainly, there usually requires a bigger build out with retail, and which requires more TI dollars. So, for fast openings, finding turnkey medical is great. You also have a lot of cross referral between the other, suite mates usually in the building, especially if you have a chiropractor nearby or plastic surgeon, even primary care doctor. They love when Gameday is located next to them because you get a lot of guys coming through our door that can certainly help their business and vice versa.
This is a really interesting topic because Dean and I spoke about this when I was presenting the concept to him and introducing it. And coming from his European wax background, he sees a lot of value in the street traffic and so forth. But this is a very different concept. And again, going back to that, the pride of men and so forth, I can see where they might be more comfortable going into a medical office setting rather than entering from like a strip mall setting, correct? So Evan, do I understand you're receptive to either depending on the client's preference or your investor's preferences, but have not found a significant value in the return on investment per se for the strip mall concept?
Yep, exactly. We have some franchise owners, in onboarding right now. I can think of a few who, a couple of them own gyms and they just want to be in retail. They're comfortable there. Sure. Just know that, you're probably going to have to invest a little more. It's probably going to be a shell space. That's fine. I'd say the majority of owners, because our digital game is so strong, and I'll get more into that, Dean, because I know you asked about, client acquisition. A lot of guys are finding us online. So, as soon as your Google presence is strong, you don't necessarily need to be, in the heart of like, a big plaza or a big strip mall. So yeah, that kind of privacy and confidentiality, I think, goes a long way for our guys. And honestly, the most important thing is parking. So for guys to show up, you got to make it simple. Don't give them any reason not to walk in that front door. If you have to have a valet near your office, it's the wrong office. Right. Got to have parking, got to be simple. Don't give them any reason to be like, I couldn't find the suite. Just make it as simple as possible.
If I buy a membership, for example, in California, and can I use that in another state? Is that transferable, or are you going to have a nationwide map for your business? Yeah,
so it depends on a few different things. So say you establish care in California. If you establish care at your Gameday in, let's say, San Diego, and you move to Miami, so you can certainly still be a member of that Gameday because you've established care at that office. What you can't do, and this is more of a DEA regulation, is live in Miami and say, hey, I want to go to the Gameday in San Diego and I just want to do a kind of virtual consultation. Those are actually almost virtually not happening anymore. DEA is tightening regulations, which is good for us being brick and mortar. During COVID, they lifted a lot of regulations, and you can get on a Zoom call like this and get prescribed testosterone without an evaluation, without a lot of due diligence. Having said that, yeah, we'll have brick and mortar is the model nationwide, so you can certainly transfer to say you move to Miami, go to the Miami Gameday, and off you go.
Right. No, and it's very interesting what you just said, because I don't think a lot of potential investors are aware that the compliance has come down harder on the virtual, because they're now ramping their game up extremely high, the virtual. Now, I was never even aware of it until a few weeks ago, and now you see it everywhere. Yeah. So
the virtual model is good, Dean, for more over-the-counter, non-controlled substance medication type things. So you're talking your primary care doctor, right?
Or not even prescriptions.
Yeah, exactly. No, prescriptions are fine, but you don't want to. Controlled substances, DEA is taking a real hard line on. Look, testosterone, believe it or not, is considered a controlled substance. It's a Schedule 3. So they say, look, no, you need to have an evaluation in office by a provider. The COVID restrictions are going to, the COVID, lifting is going to stop, and it's going to go back to the old way where you got to be face to face, that type of thing. So good for perfect timing for us. And we feel like it always should have been like that, because there's a lot of these telehealth type things going on where you want to manage risk. You want to manage side effects that might pop up. And these guys are on testosterone. It's just
on your business model, Evan. I wanted to know, what percentage of it is ED? What percentage is testosterone? What percentage is hormone? Do you do any general medical blood work that separates you from an internist that that they're not going to get with an internist that sets you apart?
For sure. Yeah. So every day, more and more the business is getting expanded by the ED side. So I think we started out 100% hormones, TRT, peptides. Now it's about 65-35 still in favor of the hormone side, the testosterone side. ED is gaining more and more of a market. A lot of guys who have ED, they're always, not always, but a lot of times they're going to have low testosterone. A lot of guys who have low testosterone will have ED. So you see a lot of crossover there. To the second point on, do you do kind of the general things? The short answer is no. We want to stay right in our lane, and we don't want to become, hey, you have a cough or a sniffle, come on into Game Day. That sucks the provider's time. It's not a good business. It's really hard to make money that way. We do kind of our core 4 services. We certainly, are always adding on, but testosterone replacement, weight management, erectile dysfunction and vitamin therapy, those are all like membership based or package based. If a guy comes in and he says, hey, can you, examine my leg? Would love to, but let's find a referral for you for a specialist. We can get you going in that direction. It's happens all the time. As soon as guys come into Game Day, they're like, this is amazing. You guys are medical professionals. There's all these clinicians. You guys can handle everything I need. And so you kind of have, so I'm actually, we stay in our lane. Because guys, once we like a place, we're loyal, we trust it. We just want to go there only. But unfortunately, that's just not our model. We keep it simple, streamlined, all those things.
Yeah, and I think that's where your cross referral, comment came in earlier, that being in that medical space, close to other medical providers, comes in very useful. So before we, I know Dean had a question about client acquisition, but one thing I'd like to dig into a little deeper, though, is the competitive landscape. So what does that look like, Evan, from your perspective?
Yeah. There's a few kind of larger corporate-owned national brands, easy to find, easy to Google. What they lack, though, and what we've found is our 2 key differentiators. Having the lab in office is huge. A lot of these, bigger competitor national chains, they're going to tell you to, hey, let's book you a consultation. That'll cost $199. Now I want you to go to Quest or LabCorp, and then we'll schedule you to come into your office. Less than 50% of guys are going to do that. So immediately we removed that kind of limitation. Come on in. It's not only is it, we have a lab on site, but it's a free consultation. So the free consult with the lab in site, and combine that with our Google presence, we tend to rank 1, 2, or 3. We go after a city, we usually get it. You're going to give this guy no reason to not try Game Day. Look, there's a great Google presence. The reviews are strong. They're number 1. It's a free testosterone test. They have a lab in the office. Maybe I'll call these other guys. Oh, wait, I got to go pay a consult fee. Maybe I have low T. I still got to go to the lab. Forget it. I'm over it. Let's just go to Game Day. So they don't have that model. We do. We really privilege speed and efficiency in that regard. And I kind of take, the whole Jeff Bezos mentality on top of it, which is just delight every guy that walks in the door, and it makes your competitors just obsolete. And so we really have a lot of good training and systems on patient retention, getting to know each guy. Every guy who comes into Game Day, we call it just continuing the conversation. So once you get to know him, the next time he pops in, it's, hey, how was that trip, your ski trip? Or how was your kid's, baseball game? How's he doing? Really getting to know him personally. We have actually these little cheat sheets in every patient's chart. It's just called fun facts, so that anybody who looks into John Smith can see that here's what he's into. And it just creates that extra layer of customer service. And so that's why I think we've just been able to grow fast, retain guys, in a much more robust way than a lot of these other places. All right.
So based upon that, I before we hit on the client acquisition again, I am gonna, your client acquisition is pretty phenomenal. So what I would like to hit on is some of your ROI numbers. And, I will only bring this up certainly when it's in marketing material or it's in your item 19 of your FDD. But your affiliate locations, this is pretty phenomenal. So $2.5 million in gross revenue and 962 in adjusted earnings. And that's for your top affiliate location. But your affiliate location averages is 1.8 million gross revenue with 627,000 adjusted earnings. And that's with, as I understand it, a 65% average lead to member conversion. That is phenomenal. So Dean, number one, Evan, congratulations. Dean, given your experience with franchising in the franchise world, what are your thoughts on that?
I think it's unbelievable, the return on investment. I think that, one of the things that, people that are going to be looking for this franchise are going to be wanting to know about the cost of the build out, the territory, how much protection, circle protection they have, because the numbers speak for themselves. And the fact about the lab inside the office, that's a game changer.
I agree with you.
I think that the comfort zone also of a place where men can go in and know that that's their quote unquote space to go into and not feel intimidated or awkward about seeing some woman that lives down the street from them is also a great thing, because a guy can look at a guy and go, listen, guys suffer from this stuff. I mean, it's becoming more and more prominent. Our communities are getting older. Even youngers suffer from it. There's some depression involved in this. So I think more of my question would be to Evan right now would be like, Evan, what do you need for staffing one of these centers? I think that's a fair question.
Yeah, for sure. I think that's why a big reason why the margin is so healthy is because our staffing model is nicely kind of lean and tucked in. So, compared to like certainly in medical practice, hospital setting, of course, there's a lot of clinical professionals running around and they're not cheap. At Gameday, we do, you're going to have a medical director. The medical director is going to be a physician, so either an MD or a DO, and they're strictly there to supervise. They're not seeing patients. So they're going to supervise a mid-level clinician, which is either a nurse practitioner or a PA, a physician assistant. So you have the MD supervising either a PA or an NP. That mid-level, the PA or NP, you've seen them at places you've gone to probably get checkups. They're great. I mean, they're super qualified. They can do a lot of the things a physician can do. They just have to report to the doc. The doctor, in terms of pay rate, looking anywhere from $2,000 to $4,000 a month, because we're not asking him or her to be on site seeing patients. Doctors love our model because they're allowed to have their own kind of day job going on. They don't need to stop anything they're doing. We just ask that they make sure that they're doing the absolute minimum to make sure that the office is compliant with the state board. So signing off on charts, making sure that they're available for calls or emails or texts that happen if that mid-level needs more support. And they're salivating over our model. They're kind of waking up to the fact that, wow, I can kind of have, nice supplemental income and supplemental job and keep my day job. So, it's funny, we had a call. We do a call every week now, and we've posted for medical directors throughout the country. I think last week we had 57 doctors on the call. We have like 4 doctors for almost, all the major cities just ready to go. And they can't wait until we have new franchises. So that part's been awesome. Docs love it. They're super receptive. And they like that, hey, it's like, an owner is going to have maybe multiple clinics. That can certainly become nice supplemental income. It's not full-time work. You're asking maybe 10 hours a month for the doc to be on site. The mid-level, meaning the PA or the NP, they're the one who does the heavy lifting every day. They're the face of the practice. And those folks are going to be your most expensive employee, anywhere from, say, $55 an hour in some markets up to maybe $70 or $80 an hour. They're, the head honcho. They're the one who is doing a lot of the signups and making sure patients are starting on programs if they qualify, of course. Under the mid-level, meaning that PA or NP, you're going to have 1 or 2 medical assistants. Medical assistants are, about a year or 2 of a kind of a licensure program, doing a lot of blood draws and a lot of injections. Our MAs, that's primarily what they do, and then chart those blood draws and injections in the software. And a receptionist. So your receptionist, 1 or 2 MAs, your mid-level clinician, we call it the clinic director, is that PA or the NP. That's 4 in the office every day, and then the doctor who oversees them. So staffing is lean, and that's really what you need. Certainly when you reach 300 or so patients at your office, maybe 350, you want to add on that second clinician. That's kind of when the first clinician's like, help, I'm tapped out, but that's a good problem.
So I think...
Right. So would you say that right now, or your future growth of this, you will have or currently have two medical assistants working at the same time? Like there's enough traffic in there to handle two, maybe even three medical assistants going at the same time?
For sure.
And what is the average ticket per day?
$250 is the average right now. It's trending upward because there's a lot more ED packages are being sold. Still primarily, hormone based and testosterone based.
And how many people a day are you seeing?
So new patients on a busy day, you're seeing about. It depends on how long the office has been open, but certainly I can get data. They're seeing about anywhere from 8 to 10 to 12 new patients a day. Having said that, the foot traffic is a lot more than that because you have guys who are established patients coming in for, say, injections or treatment. Sometimes you can have 50 or 60 guys walk through the door in a day.
Do you sell any over-the-counter supplemental products that go along with, that complement the stuff that's going on at Gameday?
Yeah, so there's certain products we ship direct from the pharmacy to the house. We don't keep a storefront of merchandise. It's just been, we had our own supplement line for a few years. Just found that the margins weren't great, and the margins on the services we have are really high margin. I like that. Keeps it simple. You don't have to worry about, constantly shelves with multivitamins. The guys like the multivitamin and they go on Amazon and find it for $8. So it wasn't real sustainable for us. However, there's certain supplements that are really powerful with like testosterone replacement. There's something called DIM. Our pharmacies have a great compounded version. Certainly it can be added on and then just shipped right to his house.
Does your I'm assuming that the Gameday does write the prescriptions. Your staff is qualified to write prescriptions for whatever deficiency the patient is having.
Yeah, Gamedays are medical.
Have to go to another doctor. In other words, you take care of all that. It's one-stop shopping for the things that are in your lane.
One-stop shop. Gameday's medical practice, overseen by licensed physician in that state, just as you go to your regular primary care doctor. The clinician, the nurse practitioner, PA, they're licensed in that state. They have DEA registrations, fully compliant medical practice. They have all prescribing authority. Yep.
Yeah, I think that for the clientele that I talk to, that is certainly interested in the medical space, many people think that this is a segment that they cannot get into, but with a concept like Gameday, even though it is a medical clinic, an investor like myself or Dean or, somebody that does not have any medical background, this is absolutely an achievable investment, assuming they meet various requirements, without that accreditation because of that medical director that will be overseeing the clinic. So let me just introduce a couple things. So one, I know Dean had an outstanding question about client acquisition, and I know any investor is going to be very interested in that. So Evan, can you just briefly touch on that, how you guys are able to rate so high on Google and how you really do execute that client acquisition?
Yeah, this is, I guess, part of the secret sauce, but certainly it's what makes us so fast to get guys in the door. So number one is our SEO is very strong. We invest a lot in SEO. When we do it the right way, we're not spamming Google. We're doing tons of backlinking. Hundreds and hundreds of landing pages are being pumped out right now around the country for locations we don't even have yet. We're just waiting for those territories to be taken. If you search TRT near a city and a Gameday's there, you're just going to run into us. That's just the way it's going to go. So we feel very good about our ability within certainly 90, 120 days, sometimes a month, to be in that top spot. So here's how it works. If you have that top spot on Google, and you also have you're looking at Google and there's the maps, right? And you see the businesses and they have all these star ratings. That's called your GMB, your Google My Business. Once you have a real strong GMB presence, meaning you have a bunch of 5-star reviews, people raving about your office, you're the number one ranking as well on organic, just that next box down, click. you're going to land on our landing page. On the homepage, every franchise has their own microsite. That's a huge value add. So they have their own calls to action that lead right into their software. It's going to say book a free testosterone test or get started now. There's going to be multiple calls to action on every landing page. Let's just say it's, Denver game day. Or do you have low testosterone? Find out with a free testosterone test. Enter their information. As soon as they click enter, that information is then immediately sent to our CRM software. They immediately get an auto text saying, hey, thanks so much for reaching out to Gameday Denver. We offer a free consultation and testosterone test. What's a good day to get you in? Boom. You want to be on that lead fast. Guys are super fickle in these types of situations, right? One day you feel like not great. The next day you're like, I actually slept well. I feel okay. Maybe I don't need it. So when he inquires, get on him quick. He can book immediately in the software, and we get him scheduled as soon as possible for that initial consultation. We teach our franchises, don't book a guy out for next week. If you can get him in same day or even next day, great. But if you book him out too far in advance, he's going to lose interest. So speed is the name of the game. All that happens very quickly. Ideally, he sends his lead across. We get him in that afternoon. He's, done his testosterone test. 15 minutes later, he's sitting in front of a licensed clinician, and then he's starting his first treatments that day. So we get a lot of guys we call curious, right? They just go, I kind of check it out. Who knows? Maybe I'm low. We do month-to-month contracts. We've never had to say, hey, it's got to be a year package, because guys, when you feel better on testosterone, it's like kind of a no-brainer. You're like, I might as well continue this. I feel great. Right. It's only a couple $100 a month. I'll spend that on a night out with, my wife or girlfriend or buddies, so it's not hugely expensive. And they feel better fast. And so that you kind of give them no reason not to just be a member,
Well, just to kind of recap, and I know you guys have been absolutely wonderful. And Dean, I've loved your thoughtful, provoking questions. But this is, when I saw this come across as an emerging brand in the portfolio, I became so passionate about it. And in part, again, it's because I have benefited from hormone replacement therapy. And I do know the significant benefits, and it's something I would let my nails go. There's certain things I would let go, but I'm not letting my hormone replacement compound cream go. That's for sure. But just to kind of recap, this is a model that it is a lower entry point. Certainly if you're looking to go into the medical office space, you have the high ticket recurring revenue membership model that is very attractive to many individuals, because that you're going to have, those clients are going to be continuously repurchasing in the coming months. This also, again, Evan, to your point of if you go into a medical office space, the tenant improvement is extremely minimal. You need maybe 4 offices, minimal build out, so therefore equaling minimal investment. So this is quick to open in that scenario in 4 to 6 months. The in-office lab results within 15 minutes, I think, not playing on the name, but it's a game changer, definitely, because I am definitely somebody that likes immediate gratification and quick resolution. And those immediate in-lab results does provide your clientele that. You guys, congratulations, you've built a phenomenal business model, and I'm so excited to see this grow. Dean, any last words, or Evan, any last words you want to touch on?
Just real quick, I wanted to ask Evans, does insurance pick, because I know somebody's going to ask him that down the road. Does insurance pick up any of this, medical insurance?
No. So we are at Gameday 100% cash pay. We originally at one point were accepting insurance. It's a very hard testosterone replacement itself, which is why a lot of primary care doctors don't do it, because they're insurance based. It doesn't pay well with insurance. Just to give you an idea, an injection of testosterone, you might get a penny reimbursed from the insurance company.
Right.
So that's why, PCPs and general practitioners aren't really competitors, because it's just it's a waste of time for them. In the early days, you kind of were able to do okay and trudge along billing insurance, because certainly people think, hey, this is a healthcare thing, I want to use my insurance. Once they realize, wait a second, I'm not getting covered under it, insurance might approve one injection a month. What's that going to do? Nothing, right? Have a premium service for just a couple $100 a month makes all the sense in the world. You have access to your provider through a text, HIPAA compliant text, your fast labs. If you're curious about, hey, what my level's at, come on in, that type of thing. Just makes it all so simple, make it cash pay. Patients have loved it. As soon as we stopped saying, hey, we're not insurance based anymore, they couldn't have been happier.
Right. I love two things about it. I love the fact that you said earlier that, you try and get the patient in that same day. I think that's a, unbelievable thing, because when you call any medical practice, it's a minimum of 3 to 6 weeks out. That's great. And the other thing I wanted to ask you, Evan, was on the testosterone at $199 a month. How many visits do you get for the $199 a month? And how do you know from, this is getting a little off the track, but how do you know if do they have enough testosterone in them?
Yeah, no, that makes complete sense. So testosterone Stiffenit, which is the testosterone that's widely used, it's FDA approved. That's another important point to make. These are FDA approved treatments. There's nothing experimental going on. The half-life of testosterone Stiffenit is 7 to 10 days. So that means it's going to last in your system for about a week. So 4 injections a month is going to be under that $199 umbrella. Some guys might want to split their injections up and come in twice a week. That's fine. We make it simple, right? It's not a big deal. I would say though, 30% come into the office, the other 70%, once we train them how to do a shot. It sounds like, I never give myself a shot. Once you do it once, you're like, well, wow, that was kind of a piece of cake. And it just becomes easier and part of like your routine once a week. Maybe you do it at home in your bathroom and you're done with it.
And Gameday itself is FDA approved. Your business is FDA approved.
So the medications we use are obviously FDA approved. Gameday itself is, these are medical offices that are overseen by physicians. So
right.
FDA approved, a physician office, it's more physician licensure. Yeah.
Okay, good. Well, that's something that's going to come up, and especially from a franchisee attorney.
Yeah.
Know about that. So,
absolutely.
Yeah, I've been around the mill so many times and know what the questions are, and those little things can trip up a whole business that's going on. But I think you have a great concept. I like the way you said about staying in your own lane and providing the 4 services. The depression service that you promote, what do you do for that?
So, speaking just depression itself, really, it's all tied to the low testosterone. So normally when guys, they feel, hey, a lot of times guys aren't going to say I'm depressed. They're going to say, I just don't feel like, or, my wife says I'm more irritated, those types of things. Well, you're kind of pointing at depression. A lot of times when your testosterone levels are low, it looks just like depression. And so when we get them just to that optimal level, the clinicians really monitor it closely. And this is another point I want to make. The clinicians at Gameday, we're not hyperdosing anyone. Everything is done according to medical guidelines. You're not going to turn into Arnold Schwarzenegger in your prime. Sorry, man. We're just going to get you feeling how you should feel. Once those levels are optimized, a lot of times those symptoms go away of depression. You just kind of feel like, wow, I kind of feel like myself again. So it works well.
No, the reason I bring that up is because if you went to a medical office, they would tell you to go on Zoloft or Lexapro and start on this kind of stuff. And I feel that you have more of the entry-level checklist for a male.
Yeah.
These barriers first, the testosterone and that kind of thing, I think will, could cross out the other stuff, and somebody on that other stuff could go further down the rabbit hole.
Yes,
yeah.
Got it.
I think this is a necessity.
Yeah, no, you're spot on. We get a lot of guys, a lot of military, firefighter, police. We get a lot of patients in those professions, and especially guys who have seen combat or been through some tough stuff. They're on a lot of medications, and they've come to us, and through just testosterone replacement, they've been able to get off it all. And they're like, man, I feel like myself again. So it is a lot of times as simple as that. Just, let's look at your blood test first. Cause you're right, Dean, you go to a primary care doctor, he's going to go, let's try this. And let's see how you feel in a month. doesn't work, we'll try something else. So we take the opposite. We make testosterone replacement like the cornerstone, like you said, the entry level point for your whole health.
Yeah.
No, I think it's great. I think it's great. I think it's smart. What about B12 shots? Do you do any of that stuff?
Yeah, B12. Yeah, for sure. Those are great. Mm-hmm.
Okay, great. Because I know that somebody that was asking me about your franchise asked me about B12, and there's this other thing now that they're doing the IV drips for energy and things like that.
Yeah, we haven't done much IV just because we tried it. We always pilot everything first at the corporate office. IV therapy, it's not truly recurring revenue. Think about it. If you go and get an IV every couple of weeks or a month, your veins they're not going to be real healthy. So, and it also sucks up a lot of clinician time. You're talking about 30 minutes to 45 minutes where someone has to kind of watch to make sure everything's fine. So we don't do IVs.
Good. And good to know, because that's another, outside competitor that's getting into your airspace, and that's what they're building a business on right now.
Yeah, there's a bunch of kind of IV places. That's fine. Yeah. Go for it, guys. We stay with high margin, services and products.
No, I think it's great.
All right, gentlemen.
Well, I appreciate your time. Thank you, Stacie, for having me on.
Yeah, gentlemen, thank you so much. Evan, you have built a phenomenal brand. I'm excited to bring this to other clients just similar to Dean and help grow the brand. So for anybody that is interested in learning more about Gameday Men's Health, please feel free to reach out to me at Stacie@fusionfranchising.com. Thank you and have a great day.